Friends and family, we welcome you to the 2026 Convocation Ceremony for the Doctor of Physical Therapy and Doctor of Occupational Therapy programs at Rocky Mountain University of Health Professions. Before the ceremony begins, please silence your phones. Now, if you're able, please stand for the graduate processional.
You may be seated. Good afternoon, distinguished guests, faculty, graduates, and families. My name is Dr. Brian Gee, and I'm the chair of the Department of Occupational Therapy and the director of the Doctor of Occupational Therapy program at RMU. It is my privilege to guide you through today's ceremony. Welcome to this afternoon's convocation ceremony for the College of Rehabilitation Sciences. This is our first convocation. We're honored to gather and celebrate the achievements, dedication, and perseverance, as I look at these graduates here, for our Doctor of Occupational Therapy and Doctor of Physical Therapy graduates. I would like to invite Dr. Jeff Lau, our college dean, to offer the official welcome. Dr. Lau.
Well, welcome and good afternoon, everybody. Hopefully that's not too loud for you all. On behalf of the College of Rehabilitation Sciences, I want to extend a warm welcome to not only our university leadership and faculty and staff, but especially to you, our guests and visitors, families and friends, and especially the remarkable graduates for our Doctor of Physical Therapy and our inaugural Doctor of Occupational Therapy programs for the class of 2026. As Dr. Gee mentioned, my name is Jeff Lau. I'm the Dean for the College of Rehabilitation Sciences. And it's really an honor and a privilege to be here with you today. Today really marks a transition, a close to one chapter of your lives and the beginning of another, filled with promise. And for our graduate graduates, it really represents a day to sort of reflect on all of the things that you've faced over the last number of years. Challenges that you've overcome, clinical training you've experienced, the perseverance you've had to really show to make it through really rigorous programming and training. Your journey really has required long nights, countless evaluations, constructive feedback from lots of different people. But you've developed so many skills, not only just professional standard types of skills, but skills that will stand you in good stead through the long run of your profession. Things like caring, compassion, and character growth that will help make you the best practitioner you can be. So I want to take just a moment to recognize those who have supported you through your journey. So of course we have our wonderful faculty and staff, but especially I want to take just a little bit of time to recognize the family, friends, and even your patients who allowed you to practice on them to develop such high-level skills. So if you would, just take a minute to give a round of applause to those who are here to support you. Finally, I just want to take this moment to encourage you to just pause for a minute, breathe it in, stand a little taller and feel the weight of your accomplishment. Right? This has been a long time in coming for most of you. Think about what you've earned, the price you've paid, and the excitement of what lies before you. It'll give you purpose, fulfillment, and countless opportunities to do probably what you thought about the whole time when you were in here, to make the difference in the lives of others. So, graduating class of 2026, congratulations. We're proud of you, we're inspired by you, and we're eager to watch the impact you're going to have on the world. Thanks and welcome again.
Thank you, Dr. Lau. We're now privileged to hear from some of our graduate speakers. So first, please join me in welcoming Kristen Ellis, OTD Cohort number 1, and is the representative for that cohort on the program's advisory board. Kristen.
Hello, everyone. As Dr. Gee probably said to us 100 times throughout our program, are you guys so excited? Because I am so excited. On our first day as occupational therapy students at Rocky Mountain University, our cohort of only 6 went around and we shared why we chose OT. While our reasons all varied, we knew that we all wanted to make a meaningful impact in the clients and the people's lives around us. We had a general idea of what we thought occupational therapy was, but we still had a lot to learn about our field and the broad scope of practice that comes with it. Well, since that day, we have completed 774 hours in a Zoom classroom, 608 hours in person during in-person learning weeks, 1,080 clinical hours on clinical fieldwork rotations, and 448 hours completing a doctoral capstone project. We've learned to approach client care through a truly holistic lens. We developed the ability to analyze any activity that occupies a person's time and evaluate what factors are preventing participation in that meaningful occupation. We then learned how to create individualized and creative interventions to then empower engagement in those meaningful occupations for our clients that makes them who they are as a person. And then after all of our brains were as full as they could get, and we couldn't shove anything more in there, we got to go out on clinical fieldwork rotations and put our knowledge to the test. For me, this is when everything actually clicked, and I got to see firsthand the impact of the profession that I chose and that you guys all chose along with me. As I reflected on my fieldwork experience, one client kept coming to mind from a rotation in inpatient rehabilitation. When this client was first admitted, she had a C5 level incomplete spinal cord compression. And so she was able to move all of her extremities just a few degrees, and she needed complete assist for every occupation. During our initial evaluation, I asked her what her goals for her stay was, and she would expect nothing less than complete independence in all self-cares. She wanted to walk and play golf again, and she wanted to immediately return back to work as a recreational therapist. And to be honest, I was very overwhelmed. In theory, I knew what to do. We had studied it for the past year, but I didn't know what to expect or how our progress would work together. In general, she stayed on the unit for 4 weeks, and I got the opportunity with my supervisor to be her primary OT for the full stay. During those weeks, we made getting dressed a competition, timing how fast she could get her shirt on to see if she could get it faster this time than the last time. I think we played maybe 20 games of her favorite game of Rummy Cube, and I think I lost every single one of them despite my best efforts. And overall, we looked together to figure out what she wanted to do next and how to keep progressing her towards her very lofty goals. On her last day on the unit, she got ready for her day independently, and she walked out of the hospital excited to go see her son's golf tournament that day. I know all 6 of us had very important clients like this on our fieldwork rotations, and we're just going to continue to have this impact on people's lives. Maybe we went into our fieldwork with uncertainty and nerves, and maybe we have uncertainty and nerves now going into being an entry-level provider. But we came away from this program knowing the impact that occupational therapy could have, and with increased confidence in our skills and our understanding of our individual role on the healthcare team. To finish out our time in the project, we got the opportunity to do a doctoral capstone project. Within our cohort, we advocated for women's health in occupational therapy and created a program that we could transition roles of new mothers into their new lives. Created and implemented a program to address test anxiety in 3rd graders, address the need for trauma-informed care, education, and OT programs, explored the use of animal-assisted therapy in occupational therapy, taught and implemented peer-mediated interventions for adolescents, and assessed active and occupation-based learning in anatomy and kinesiology for OT education. Each of us overcame unexpected challenges in this project, but we were able to grow with resilience, grow our problem-solving skills, and really become self-directed learners that then we're going to be able to take into our future lives as providers. We learned how to put our own learning above anything else, and we know how that we can take that going forward. Throughout these challenges and growth, though, we were never alone. To our professors, mentors, Dr. Gee up on the stage, and the rest of our faculty at home, you modeled resilience, you challenged us to think deeper, and you encouraged us even when we were unsure ourselves if we were ever going to make it to that day. And trust me, there were moments that we all were unsure. I can't express enough gratitude for the large role you played in our education and the start of our careers. To our friends, families, and supporters, thank you for your patience, your encouragement, your understanding when we continuously said, no, we can't do that, we have to study. And we know that we couldn't have done it without you. And finally, to my fellow graduates, we spent the past 3 years learning the vast areas of practice that we can now enter as occupational therapists. We learned countless models, theories, evaluation methods, how to address any deficit, probably over 1,000, in creative and engaging ways. But most importantly, we learned that occupational therapy, at its core, is the idea that engagement in meaningful occupations benefits the human experience. And I couldn't be more excited and grateful for the opportunity to enter this field and improve the human experience of the many individuals, groups, and populations that we're going to have the privilege to work alongside with. Congratulations to all of the graduates here. We did it.
Thank you, Kristen, and you are correct. I am very excited. Next, please welcome Mr. Nathan Piles, DPT Cohort 21 Class President.
Good afternoon, faculty, family, friends, and most importantly, our graduates today and my cohort, DPT 21. Woo is right. It is an incredible honor to stand here today as class president representing a group of individuals who have worked tirelessly to reach this moment. Today we celebrate not just the end of the program, but the beginning of a lifelong commitment to healing, to learning, and to serving others. When we first started this journey, many of us were drawn to physical therapy for different reasons. Some of us were inspired by our own injuries, and others to the desire to help loved ones, and many just a passion for movement, science, and human connection. But no matter how we got here, we quickly learned that becoming a doctor in physical therapy was much more about mastering anatomy, memorizing protocols, or passing exams. It's about the people. Over the past few years, we've learned not to listen just to symptoms, but to stories. We've learned that progression is not always measured in degrees of motion or muscle strength, but in courage, resilience, and trust. We've seen firsthand that healing is not linear, and that sometimes the most powerful thing that we can offer to a patient is not treatment technique, but our presence. The journey's not been easy. We've navigated long nights of studying, early mornings in lab, and moments where we questioned whether we were capable of continuing. We had to balance coursework, clinical rotations, personal hobbies, and our families, but yet, here we are. We didn't get here alone. To our professors and clinical instructors, thank you for challenging us, guiding us, and believing in us when we doubted in ourselves. You've not only shaped us into clinicians, but into critical thinkers and compassionate professionals. To our friends and family, thank you for your patience, your encouragement, and your unwavering support. You celebrated our victories, no matter how small, and stood by us during the moments when we felt the path was overwhelming. And to my fellow graduates, this achievement belongs to all of us. We've leaned on each other, learned from each other, and grown together. We've shared notes, laughter, stress, and countless energy drinks, but the bonds we built will carry through beyond this stage. As we step into the next chapter, we enter a profession that's constantly evolving. We will face new challenges, new research, and new expectations. But we also carry with us the tools to adapt, advocate, and to lead. We are not just practitioners. We are educators, motivators, and problem solvers. We are advocates for our patients, independence, and quality of life. We are part of a healthcare system that needs our voices, our expertise, and our compassion. There will be moments in our careers when the progress feels slow, when outcomes are uncertain, and when the weight of responsibility feels pretty heavy. In those moments, I hope we all remember the why we started this program in the first place. I hope we remember the patients who trusted us, the small victories that meant everything, and the impact we can have even when it's not immediately visible. Let us commit to being clinicians that never stop learning. Let us stay curious, stay humble, and stay open for growth. Let us treat every patient not as a diagnosis, but as a whole person, with goals, fears, and a story worth telling. And perhaps most importantly, let's take care of ourselves, because in order to give our best to others, we must prioritize our own well-being. Today is not just a celebration of what we've accomplished, but a reminder of what we are capable of. We're not leaving today with just a degree, but with a purpose. So as we move forward, let's carry with us the knowledge we've gained, the relationships we've built, and the passion that brought us here in the first place. Cohort DPT 21, we made it. And the best is yet to come. Congratulations and thank you.
Thank you, Nathan. We'll now begin the presentation of program awards, and I am pleased to present the awards for the Doctor of Occupational Therapy program. So the first award we have as a program, within our inaugural cohort, Cohort 1, is we have the Exemplary Capstone Award. This award goes to a student's capstone that is nominated and voted on by the faculty, that is not only impactful, but innovative and really meets the vision and mission of the program, as well as our accrediting body. So I'm pleased to announce this year's winner is Danielle Archer. Come on up. It's a long walk. Yeah. The next award is the Academic Merit Award, and this award goes to the student in the cohort that has the highest GPA, both with the didactic as well as the clinical courses. This year's award goes to Kristen Ellis. The next award is the Perseverance Award, and this is another award that is nominated by faculty, voted on, and we're looking for occupational therapy students that have navigated a significant amount of challenges and barriers, and as they navigated those, they did so with grit, professionalism, collegiality, and were successful in all their assignments and courses, etc. So this year's award goes to Miss Cynthia Urarte. Finally, the last award for the occupational therapy program is our Professional Ambassador Award. This goes to a student that dedicates their time and energy advancing and advocating for the profession at various levels, whether that be at the national, state, local level, as well as what's happening on campus. This year's award goes to Ms. Kristen Ellis. As Kristen comes up, it's important to note that she served on the program's advisory board. She was also the representative of RMU's programs at the AOTA's Assembly of Student Delegates. She was also the university's representative for the Utah Occupational Therapy Association. We now turn to the Doctor of Occupational Therapy Program Awards. I invite Dr. David Paulson to present the top scholar and National Physical Therapy Student Society inductees. Following Dr. Paulson's presentations, we will continue with the DPT award presenters who will introduce themselves. Dr. Paulson.
Thank you, Dr. Gee. For our physical therapy students, we will start with one of two awards that I'll have the honor to present. I'll name you. You can come up, and I'll share a little thought about you as you come up. These are the top scholars for our program. These students have maintained a 4.0 GPA throughout the entire program. First is Blaine Bridge. Next, Leanne Holt. Isaac Montague. Madison Westerland. And Aubrey Wood. Since it is a long walk, let me just say this. There's a lot to this program. It's a challenging program, and the skill, the knowledge base, and the sheer grit that these people have put forth is outstanding. I just want to make sure we honor them appropriately. Give them another big hand. While they go to their seats, and here's a spoiler alert, some of them might have to come back up. We will name those who have achieved the National Honor Society for the School of Physical Therapy. The National Physical Therapy Student Honor Society was established in 2018, and recognizes graduating Doctor of Physical Therapy students who demonstrate excellence, integrity, and professionalism in the areas of academic achievement, leadership, and service or research. And each of these, whom I will read, have done that. Additionally, these students demonstrate strong moral character, ethics, and personify the core values of physical therapy and our profession. So I'll read them. If you'd hold your applause till the end, I'd appreciate that. Blaine Bridge, Sarah Greger, Leanne Holt, Nathan Schneider, Elizabeth Steinert, Madison Westerland, and Damian White. Again, I'm honored to provide them with a sash and some other things, so hold tight.
Good afternoon. My name is Dr. Stevenson. I am the co-director of clinical education for the DPT program. I've worked with these students extensively throughout the program. And today I want to present a couple awards. First, an award to students who have excelled clinically during our program, which is a very stressful time, as I'm sure any of the family and friends here can attest to, receiving phone calls late at night, possibly listening to very stressful situations. But all of them navigated the clinical education component of the program very well, and I wish we could just give this award to all of them. But we have two students that excelled in all of their clinicals. Their CIs, or their clinical instructors from all of their rotations, spoke extremely highly of them. And those two students are Aubrey Wood and Alex Gomez. Now, on the other side of clinical education, we have clinicians all over the country that volunteer their time and efforts and energy to have DPT students show up to their clinics for anywhere from 6 to 12 weeks at a time and mentor them and provide instruction and provide feedback and help them connect the dots between what they learned in the classroom and how it actually fits when they're in the clinic. And we appreciate the effort and the work that all these clinical instructors put in for us. We would like to give an award to a clinical instructor who, we have our students nominees for this award. And I would like Lindsay Davis is one of the DPT students. I'd like her to come up and read her nomination for for 2 CIs that she shared for her internship.
Yeah, so I have a little bit different of an experience where I had 2 CIs during my fall clinical, as it was hard to pick one over the other, so I felt like I needed to nominate both of them, as they were both so deserving of this award. So for the first one was my CI, Cami. Cami went above and beyond during my time at Mountainland. As she wasn't going to be my initial clinical instructor, she took me under her wing and made sure I had a valuable learning experience while making it engaging and fun. Because she specialized in pelvic floor, she appropriately taught me how to teach and progress those exercises. She also thoroughly read through my documentation and challenged me to practice ways I can further improve that. Cami was also kind, caring, and friendly. She made every patient and fellow coworker feel important and valued. When my grandpa passed away in the middle of my internship, Cami checked in with me the few days following and made sure I was doing okay. Last, Cami was funny and non-judgmental. It didn't take me long to warm up and be comfortable being myself around her and the rest of the team. I think Cami is so deserving of this award for all that she's done for me. And then Stephen was also a phenomenal clinical instructor. He was very patient and gave me proper feedback on areas I needed to be appropriately challenged, such as documentation. I always felt comfortable asking Stephen questions and never felt like I was talked to in a belittled or condescending way. One of the things I appreciated most from Stephen was, so his wife and him had a little baby boy right during the middle of my internship. And then on my final week, his 2.5-year-old son had to have a pretty big heart surgery. And during our midterm and our final week, we have our clinical instructors fill out these performance evaluations that kind of assess how we're doing. And the fact that he had all that going on and he still made time to put effort into that and submit it on time meant so much to me, despite all those family circumstances he was going through. I think Stephen's a wonderful candidate of this award as he took me in and made sure I had the best experience possible. Stephen and Cami are truly both so deserving of this award. Not often can people say they love going to work every day, especially when you're not getting paid. But I genuinely look forward going to work with them and the rest of the team each day. It usually takes me some time to adjust to new environments, probably like most of us, but I got super comfortable fully being myself around them pretty quickly. I also wanted to shout out real quick the other staff there, Mindy, the physical therapy assistant, Kenzie, the receptionist, and all the amazing techs, Matt, Andrew, Annabelle, Hannah, and Logan, all for welcoming me with open arms and creating such a fun and comfortable learning environment where my confidence grew and critical thinking skills expanded, along with daily laughs and weekly inside jokes. I greatly appreciated every coworker I had at my time here, and thank Stephen and Cami for creating this healthy work environment with memories and experiences I will cherish forever. I would have gladly worked for free or paid to work for longer with them, and I'd give an arm and a leg to do it all again. Thank you.
Thank you, Lindsay. And we know our clinical associates and clinical instructors are busy. Are Stephen and Cami here? I have not got to connect with them. If you're here, come on up. If not, that's fine. I see actually a couple of our other clinical instructors here, which is neat to see. But thank you for that, and congratulations, DPT 21.
My name is Greg Koberstein. I get to present the award for leadership. All of the nominees wouldn't have been nominated if they didn't fit these qualifications. This award recognizes the student who, in overt or quiet ways, influenced, inspired, and helped others become their best selves, building their skills and achieving goals along the way. They led by words and example and helped create a
I don't know who greenlit giving me a microphone, but all the DPT students know that's not a great idea. But I'm Dr. Megan Kisner. I had the privilege of teaching these DPT students who are all wonderful, and I am presenting the Faculty Recognition Award. But before I do that, you guys all look so great, so this is gonna turn out well. All right, old school. It's gonna print right there, don't you worry. Okay, all right, so I'm gonna have the nominees stand up for me, please. There's only gonna be one winner, even though you guys are all wonderful. And the Faculty Recognition Award, I should say, is essentially, we all think you're awesome. We think you're all awesome, that we could get that, and I hope you guys know that by now. But these are faculty-nominated candidates, and then we all voted on who we wanted to win. But if we could, we would clone all of these nominees for sure. So Romy Bailey, go ahead and stand up for me, please. Yep. Harmony Beppler. Isaac Montague. Amanda Myers. DJ Dobbs. Jordan Mills Capelle. Marissa Sendejas. And Sarah Herrera. All right, and then I'll have the winner come up, but you guys are all wonderful. The winner is Amanda Myers.
Hello, everybody. I have the honor to present the Professional Engagement Award. And this is the award that got the most nominations, so you're all awesome, right? I will list out all the nominees, but before that, I'll just read the description really quickly. So the Professional Engagement Award recognizes a student who is exemplary in their professional engagement, including getting involved nationally or locally with the APTA, participating in research, providing service to the community as a student PT, or any other element that demonstrates professional involvement in physical therapy. So that goes to show the list of nominees is huge, and they all are so deserving. So I'm going to go ahead and have you all stand. Harmony Beppler, Trenton Bowler, Jessica Grebe, Leanne Holt, Amanda Myers. Oh, I forgot to check the last name for this person, so if I mess it up, I'm really sorry. Spencer Ochko. Okay, Nate Schneider, Audrey Steinhagen, and Allie Whitman. Okay, so as I said, all of you are so deserving, and there's the most awards that are being given for this one, so there's 3 awards, but you all, I have so much love for you to give. Okay, so the 3 that I am gonna list, please go ahead and join us on the podium. Harmony Beppler, Audrey Steinhagen, Allie Whitman. And as they make their way, I'm just gonna say that I have had the personal fortune to work with all 3 of them in different capacities. One is my advisee, and one is a person who worked in the MS clinic with me directly, working with the patients. And Harmony is our tremendous person who ran the CRC almost all alone, right? So thank you so much. It's a team effort, but she was always on our case, right? That's how I remember. So thank you so much for applauding for them.
This last award is the Lifting Others Award, and this award recognizes a student who, by their character, personality, and the little things they do, lift those around them. Students nominate classmates from whom they have experienced this kind of care and concern and voted the winner. To be nominated is an honor, and we will recognize those individuals now. So when I call your name, please stand to be recognized. Harmony Bepler, Trenton Bowler, Jake Jensen, Nate Piles, Audrey Steinhagen, Emilia Troiano, and Maddie Westerland. And the winner of this award is Harmony Bepler.
Congratulations to all those that were nominated and received an award today. We have one additional award to present this afternoon, and I invite Dr. Jeff Lau, Dean of our college, to come forward and present that award at this moment.
Thank you, Dr. Gee. Good afternoon again. It's my privilege to present the highest award we have for faculty and teaching at the university, the Hartgraves Award for Excellence in Teaching. And so I'd like to invite Rodri Purcell, Dr. Rodri Purcell, to come join me up at the podium. So I'll read just a little bit about why the students think he's so awesome. Dr. Purcell has been a physical therapist for quite some time. And he was actually recognized in 2025 at the university commencement ceremony for this award. But we decided together with Dr. Purcell to actually present him the award at a convocation where he could celebrate with his homies in the DPT program, right? So if you read his bio, he's done an amazing amount over his career. He's been in the military, he's been in all sorts of different clinical and teaching settings, taken leadership roles. He has multiple graduate degrees, he has multiple national board certifications and all sorts of amazing stuff as a clinician and as a teacher. But this award isn't just about his credentials and his resume. Sorry, I got a little bit broken up with my family here. It's about the impact that he has on students and that students are able to carry with them when they go out into the clinic and into the classroom and into research and all sorts of other places. In the nomination letters, just a couple of examples. One student wrote, Dr. Purcell has a way of making kinesiology not just understandable, but enjoyable. His lectures are engaging and his enthusiasm for the subject is contagious. Another student captured sort of the balance of his expectations because his classes are not easy. He's known for his compassion and understanding while remaining resolute with expectations and standards with the goal of helping students to grow and develop. So Dr. Purcell, across the many nominations you received, your students have described you as clear and engaged and deeply invested in their success. And your colleagues that contributed to your nomination describe you as organized, innovative, and generous with your expertise, among a lot of other amazing things. Our institution is stronger because of the excellence you bring to teaching and learning and to our institution. So on the behalf of the College of Rehabilitation Sciences and Rocky Mountain University, I'd like to present Dr. Purcell with the 2025 Hartgraves Award for the Excellence in Teaching. And let me grab them. Thank you.
Thank you, Dr. Lau. We now move to one of the most meaningful traditions of this ceremony, the hooding of our graduates. The hooding portion of Convocation ceremony dates back to the 12th and 13th centuries and signifies a special recognition of doctoral degree candidates. Faculty members place the hood over the heads of the graduates, recognizing their success in completing their program and symbolizing welcoming them as fellow scholars.
Now presenting the candidates for the Doctor of Occupational Therapy degree, Dr. Danielle Brooke Archer. Dr. Lauren Ashley Colley. Dr. Kristen R. Ellis. Dr. Danae Smith. Dr. Caitlin Elizabeth Spiker. Dr. Cynthia Uriarte. Now presenting the candidates for the Doctor of Physical Therapy degree, Dr. Connor Eyre. Dr. Hannah Christine Hart. Dr. Liani Nicole Holdsworth Holt. Dr. Alex Gomez. Dr. Harmony Ruby Moon Bepler. Dr. Jimmy Kampumainivong. Dr. Luis Garza. Dr. Audrey Steinhagen. Dr. Sarah Mia Herrera. Dr. Marissa Brianne Sendejas. Dr. Tulong Song. Dr. Amanda Myers. Dr. Weston Gary Sudan. Dr. Allie Whitman. Dr. Nathan Piles. Dr. Isaac Montague. Dr. Patrick Daniel Greeting. Dr. DJ Dobbs. Dr. Shelby Nelson. Dr. Nathan Schneider. Dr. Romy Bailey. Dr. Jonathan Jimenez Flores. Dr. Hope Peterson. Dr. Blaine Bridge. Dr. Jordan Campbell. Dr. Reese Darrington. Dr. McKenna Wiscombe Harris. Dr. Spencer Ochko. Dr. Ryan Seedig. Dr. Daniel Caleb Godby. Dr. Jordan Alexander Mills Capelli. Dr. Sarah Rasmussen. Dr. Hunter Bradshaw. Dr. Shane Allen Duran. Dr. Aubrey Jill Wood. Dr. Trenton Bowler. Dr. Cameron Dyering-Gagan. Dr. Jacob Matthew Jensen. Dr. Lindsay Davis. Dr. Braden Johnson. Dr. Maddie Westerland. Dr. Aaron Hackett. Dr. Amelia Troiano. Dr. Damian White. Dr. Katie May Leister. Dr. Emma Gabrielle Nieves. Dr. Sarah Greger. Dr. Ellie Steiner. Dr. Jessica Gribby. Dr. Joyce Shin.
Where's Kristen? Are you guys so excited? I am very excited. Congratulations to our graduates. It's my privilege and honor to invite President Cameron Martin to the podium to offer some remarks for us.
Thank you, Dr. Gee. Hello, everyone. It was great to greet you as you sauntered across the stage. Congratulations. In fact, you are quite the amazing sight to see, all these new minted doctors. Hello? Are you not excited? All right. Just checking. You really are an amazing sight to behold. But I'm going to ask you to do something really important. All right, this is an interactive part of the program. Dr. Lau asked you to recognize your support systems, and you did it C+. I want you to stand, find the support system in the crowd, and let them feel and hear of your appreciation. That's a B+. Let's try it one more time. All right. Now stay standing. And look at your faculty and also the staff of your programs and let them hear and feel of your appreciation. Thank you. You may be seated. There are many people in the program and the event staff who are working tirelessly behind the scenes to make sure that your educational journey and your celebration today is seamless and enjoyable and most memorable. Please take a moment as you, at the conclusion of today's ceremony, to find them and say thank you to them. Would you please? Now, I recently had a very unexpected and delightful awakening, personally. On a flight to Seattle, which is a short flight, I decided I was going to touch the screen and see what kind of movies there are. But it's too short of a flight, so I thought, okay, I'll click the TV series tab. I discovered a whole new world. There are so many Star Trek series I had no idea existed. It changed me. It truly did. I was so excited. I mean, there's Star Trek Discovery, which is like it's the prequel to the OG, and then it transforms, wow, 900 years into the future then. And then there's Strange New Worlds, Prodigy, and Picard. I love Jean-Luc Picard. He made Bald beautiful. So, at least in my world, it was amazing. I didn't know it existed. It exists on the Paramount streaming service, and I was thinking to myself, I don't want to pay for another streaming service, but I have. It's the best $13.99 ad-free investment I have made on a monthly basis. Currently, I am in season 4. I have a lot to catch up. Maybe all you knew this existed. I did not. This is a true story. Ask my wife. And I'm on season 4 of Discovery. Now in season 4, they have zoomed forward in the future, and they are discovering great and unexpected foes and forces, and then they're also trying to reestablish Starfleet and the rebirth of the Federation of Planets. Who knew? I didn't, but I do now. In episode 2 of season 4, the character Saru, who is a newly minted #1, if you're a Trekkie, you know what that means, see, the captain is Michael Burnham now. Saru says to Tilly, another shipmate, a statement that I want to let sink in. Listen to it. How we choose to spend our moments in the short time we have matters. How we choose to spend our moments in the short time we have matters. I concur. I completely concur. Let's break it down, shall we? The first word, how. I firmly believe the secret is in the how. How we say something determines what is understood. How we go about our jobs on a daily basis determines the efficacy of that experience. In fact, this morning, I was up at the University of Utah at a kindness summit, One Kind Act a Day. And Bishop Phyllis Spiegel said this: "It matters how we speak more than what we say." The secret is in the how you go about and how you perceive life. In fact, the next part of that phrase of Charoux's is how you choose to spend our moments. Moments are powerful. If I reflect back on my life, there are moments that I treasure, moments that have melded me into the person I am. Moments are powerful. Life is filled with them. Experiences that can either define you or refine you. Oftentimes we get sucked into the mistake and we think, don't let it define you. Learn from it. Let it refine you. Let it help you become the practitioner that you hope to be. It can help you or hinder you. That's your choice. Again, it's in the how. The next phrase, in the short time we have. Well, life is fragile, ladies and gentlemen. It truly is. As you well know, you are have already been helping people who have discovered and entered into the frailties of life, right? That's the profession you've chosen to enter into boldly and nobly. And, okay, never mind. Any Trekkies out there, really? Are there? Okay, thanks, brother. I appreciate you. You've chosen a profession to help people in need, and that is noble, truly noble. The last word matters. It truly does. How you choose to do what you do and go about what it is that you have a responsibility to care for matters. You matter. Those you live among and with matter. Those you will serve in clinic or in your home or community, they matter. So really the question is, how will they know they matter? How will they know they matter to you? And again, the secret is in the how. It's in the how. Or it's how you give of your time, your talent, and your treasure. Or not. The converse is also true. The mission of Rocky Mountain University is to educate and advance healthcare professionals and leaders to improve the human condition. Those are powerful words, and that's a powerful mission and vision that we have. I like to say the how behind fulfilling that mission is by loving and lifting those in need. To love someone is to see them for who they are, meet them where they are, and to listen to what they say. Those are three powerful characteristics and attributes that I invite you to take on in your practice. Because if you do that, those you care for, live among, and serve will know that you do love them. Therefore, your ability to lift them is exponentially enhanced. If you look at your diploma covers right now, you see the logo, the seal. As you see and look at that diploma and have it hanging on your office wall where it may hang, every time you see that seal, you need to see yourself. That is your hand in that logo that is making the valleys, the mountains and the valley of where we sit here in Provo, Utah. Now, the silhouettes of the upper mountains next to the yellow, it's technically a warped perspective of the state of Utah, or it's kind of a heart. So we've trained you not only to have the hand, but also the heart in how to love and lift and treat those that you serve, work among, and choose to give yourself to. So congratulations to you, graduates of our newly minted Doctorate of Occupational Therapy and our Doctor of Physical Therapy program. Let me just simply say this in closing. Choose to make each interaction with your patients and those you live, love, and serve among Make them moments worth remembering, because life is short, and how you choose to live it truly matters. Live long and prosper. Thank you.
Thank you, President Martin. Please turn your attention to the screens for remarks from Dr. Gloria Dio Esona, the Alumni Association Board President and DNP alumni. Following her presentation, we'll hear from Dr. Steve Wilkinson.
Our MU graduates, you did it. Your long nights, your hard work, and your fierce dedication have led you to this remarkable achievement. It is with great pleasure that I officially welcome you to the next phase of your life as you become the newest members of the Rocky Mountain University of Health Professions Alumni Association. We invite you to get involved, be informed, and stay connected with this great university. And know that you are surrounded by a large alumni community who can support you. Congratulations, graduates. We cannot wait to see you wherever your journey takes you next.
Oh, there you are. Congratulations. What a great day. The OTD 1 group, congratulations. DPT 21, congratulations. So I have a bit of a love-hate relationship with this day. I love celebrating this incredible achievement with you, but I hate that you're leaving us. That part is hard. There's another reason I wasn't looking forward to today. Just over a year ago, I was given a bonsai tree. We won't say who gave that to me, but you may know one or two of them. It was an incredibly thoughtful gift and truly one of the most meaningful gifts I've ever received. I was especially touched because I've always had a quiet fascination with bonsai. Bonsai trees are shaped over years through pruning, wiring, care, and patience. Every curve of the tree, every direction of the branch are not by accident. It's a result of intentional guidance over time. So when I received this gift, I expressed my gratitude, but I also admitted that I wasn't really thinking I was up to the task. But I was determined to take care of it. I had it there in my office. I watered it every time the moss got dry, just as I was told to do. I checked on it regularly. I even, yes, it's true, I spoke to it. But the other reason I wasn't looking forward to today is because I knew I would have to tell you this. I killed the bonsai tree. It's funny for you. It's not so funny for me. It was not for lack of caring or trying, but I found out later that certain trees can't survive inside. They need to be outside. I'm embarrassed and still sad about this. My day of reckoning is your day of celebration, and maybe that seems fitting for all we put you through. But that bonsai taught me many lessons, and I want to share 3 of those with you today as you begin your journey as clinicians. First, stature. Bonsai trees are small, but they're not insignificant. Their impact comes from attention to the smallest details. And your impact as clinicians will often work similarly. It will be the small things, adjusting a pillow, remembering the name of a patient's child, taking a moment to truly listen. These things won't show up in your documentation, but they are often the things that the patients remember most. Important things, lasting things often come from very small moments and gestures, as we heard the president speak about. Second, patience. Bonsai trees are not created quickly. They are shaped over years and even decades. And in healthcare, you will have that same type of reality. Patients won't always progress as quickly as you hope. Outcomes won't always match your effort. And you may not feel confident as quickly as you expected. So be patient. Be patient with your patients, but also be patient with yourself. You are still growing into the clinician that you are becoming. And third, environment matters. I didn't lose that bonsai because I didn't care. I lost it because I didn't understand the environment it needed to survive. You're going to see this every day in your practice. You'll do everything right and still not get the outcome you expected. That's not because your treatment was wrong, but because the environment didn't support it. So your job is not just to deliver the right intervention, it's to help create the right environment. And an environment where a patient feels safe, where they feel heard, where they feel capable of succeeding. The cool thing about this is you're standing in the clinic or the hospital doesn't matter. You have the ability to change the environment for better or for worse day one. Be the catalyst for making a better place. So if you remember nothing else, remember this. Be the bonsai, beautiful and strong. Guys, doing so good, wasn't I? Small but impactful. Never underestimating the small things. Patient with growth, both within your patients and yourself. And intentional about creating environments where people want to be around you and where they can truly thrive. As a representative of the faculty, let me remind you that we're still here. We're no longer your faculty, we are now your colleagues, but we're still willing to answer questions, brainstorm ideas, and talk and listen. We love you guys.
We're so proud of you. Congratulations.
Thank you, Dr. Wilkinson. I have a script here. I'm going to deviate from it just for a minute, so I apologize, Gretel, wherever you're at. Today is significant especially for you as graduates. Moments ago, you were a student, now you're a colleague, right? And I've been a consumer of physical and occupational therapy at certain points in my life. And so I'm planning on, I may end up being one of your clients, okay? So I have some advice, I have some requests. The first thing is as you go out into practice, your professional ethics is always at the forefront. Always, always, always. That's the first thing you fall back on is your ethics. Number two, your frame of reference or your model or your theory or your rehab philosophy, the number one is compassion and caring. The last one, and this benefits all the programs at RMU, is give back to your profession. And the best way to do that after 6 months of practice, after a year of practice, is to take clinical students, okay? Today is significant for the Doctor of Occupational Therapy program because this is our, however you want to call it, our premier cohort, our inaugural cohort. And there are a number of folks that are watching over YouTube, and so I want the 6 of you to go back and see what they're saying in the chat. Starting a new program takes one type of faculty member or faculty team. It really takes pioneers. Normally there's 2 types that run a program. It's pioneers and implementers. But when you start a brand new program from scratch, it takes pioneers. And the 6 students here, OTD students, have navigated some implementers and some pioneers. And they don't know this, but they have been colleagues within being as a pioneer in starting this program. And the reason why, they don't know that they know this, but the reason why I know that they've been colleagues all along is they were never afraid to ask me hard questions or say, Dr. Gee, I got a bone to pick with you. And there has always been a level of mutual respect. And I want to congratulate these 6 and say thank you. Okay, back to the script. I would like to thank our speakers, faculty, guests for making today so special. To our graduates, congratulations. We as a university are proud and look forward to the impact that you'll have, not only on your professions, but on your communities. Let's see. If I could, if friends, family, please stand for the graduate recessional and enjoy some light refreshments that will be in this room following the ceremony. Thank you.
Thank you for attending this convocation ceremony. As you celebrate and enjoy refreshments, please take a moment to visit the RMU store in the southeast